Slow healing wounds. A tiny cut should not feel like it applied for permanent residency on your skin. You nick your finger, scrape your ankle, or get a small blister, and normally your body sends in the repair crew fast. Platelets plug the leak, immune cells clean the mess, fibroblasts build collagen, and new skin cells crawl over the surface like tiny construction workers with microscopic helmets. Very organized, very underpaid. But when a wound keeps reopening, staying red, leaking, swelling, hurting, or just refusing to move on with its life, the construction site may be missing supplies. Healing needs blood flow, oxygen, nutrients, immune defense, and a clean enough environment to rebuild. If circulation is poor, the delivery trucks cannot reach the site. If infection is present, the workers stop building and start fighting. If blood sugar is high, diabetes can damage blood vessels and nerves, making wounds harder to notice and slower to repair. Medline Plus also lists infection, diabetes, and poor blood flow as reasons wounds may take longer to heal. The everyday version looks boring until it is not. A shoe rubs your heel, you ignore it. The spot keeps getting angry, and suddenly your foot is running a tiny drama series no one subscribed to. This does not mean every slow scab is a disaster. Sometimes you picked it, stretched it, soaked it, covered it badly, or let your jeans scrape it all day like sandpaper with legs. But a wound that will not heal is not just skin being lazy. It is often a supply chain problem, not enough blood, too many germs, not enough building materials, or the body's repair crew stuck arguing with inflammation. So keep wounds clean, protect them, stop auditioning as a scab archaeologist, and pay attention if a sore keeps coming back, lasts unusually long, gets warmer, more painful, swollen, smelly, or changes color. Because slow healing is not your skin taking its time. It is the body's repair site blinking its hazard lights saying, "We have a delay and someone should check why the cement truck never arrived." Dark neck. You cannot scrub every dark patch away. Sometimes the neck is not dirty. It is delivering a message your soap was never hired to handle. A dark, thick, velvety patch on the back or sides of the neck can be called acanthosis nigricans. It often shows up in skin folds like the neck, armpits, or groin, and Mayo Clinic describes it as dark, thick, velvety skin that develops gradually in body creases. The important part is this: it is not automatically a hygiene problem. Scrubbing harder can just irritate the skin, like yelling at a smoke alarm because the kitchen is on fire. The signal is coming from deeper in the system. One common link is insulin resistance, where the body's cells do not respond to insulin as smoothly, so insulin levels can run higher. Cleveland Clinic notes, acanthosis nigricans is often, though not always, a sign of prediabetes or diabetes. Think of insulin like a key trying to open the cell's fuel door. When the lock gets stubborn, the body sends more keys, and that extra signaling can encourage skin cells and pigment cells to overgrow in certain folds. The neck becomes a dark velvet notice board nobody asked for. The everyday trap is assuming it is just dirt, tanning, or bad skin. Someone may shower, exfoliate, change products, and still feel embarrassed because the patch stays there like a stubborn sticker from a jar. That is where empathy matters. This is not about being lazy or unclean. It can be genetics, hormones, weight changes, medications, or metabolic signals showing up on the surface. So the smarter move is gentle care, not sandpaper energy. Moisturize, avoid harsh rubbing, and if the patch is new, spreading, very thick, itchy, or shows up with other changes, it is worth checking what your body may be trying to say. Because a dark neck is not always a stain. Sometimes it is skin acting like a dashboard light, quietly saying, "The engine under here deserves a look." Finger clubbing. Look at the fingertips, not the fingerprint. Sometimes the clue is not a rash, a cut, or a color change. It is the shape of the fingertips slowly getting rounder, wider, and softer, like the nail decided to wear a tiny helmet. With finger clubbing, the tips of the fingers can become bulbous, the nail may curve downward, and the normal angle between the nail and the skin can flatten. It usually happens gradually, so people may miss it until one day their hands look different while holding a cup, typing a message, or comparing old photos like a detective with Wi-Fi. The exact mechanism is not fully settled, but clubbing is linked with extra soft tissue under the nail bed and changes in blood flow and growth signals. In some cases, it shows up with long-term lung, heart, liver, or digestive conditions, especially when oxygen or circulation has been under stress. Think of the fingertip like a quiet construction zone. More signals, more tissue, more remodeling, and suddenly the architecture changes without asking permission. This does not mean every rounded fingertip is a disaster. Some hands are naturally shaped that way. But new clubbing, especially on both hands or with coughing, shortness of breath, chest symptoms, fatigue, or weight changes, deserves attention. Because finger clubbing is not your nails being quirky. It is your fingertips quietly changing shape, like the body left a small note at the end of your hand saying, something deeper might be worth checking. Yellow eyes. When someone says, your eyes look yellow, that is not the kind of comment you brush off like bad lighting. The whites of your eyes are supposed to stay boring. Plain. Background character energy. So when they turn yellow, your body may be showing bilirubin, a yellow-orange waste pigment made when old red blood cells get broken down. Normally, the liver filters bilirubin from the blood, sends it into bile, and your body moves it out like a responsible waste management department. But if bilirubin builds up, it can leak into tissues and make the skin or whites of the eyes look yellow. Cleveland Clinic describes scleral icterus as yellowing of the whites of the eyes when bilirubin is not being filtered properly from the blood. The weird part is that your eyes are not the main problem. They are the billboard. The issue may be happening in the liver, bile ducts, gallbladder, pancreas, or blood system. Think of bilirubin like yellow trash bags moving through a city. If the liver processing plant slows down, the bile exit road gets blocked, or red blood cells are breaking down too quickly, those yellow bags start piling up in places they do not belong. Suddenly, your eyes look like they installed a warning light from a submarine. This can come with dark urine, pale stools, itching, belly pain, fever, fatigue, or yellow skin, depending on the cause. That does not mean you should panic every time your eyes look a little tired in a bathroom mirror designed by a villain. But true yellowing, especially if it is new or comes with other symptoms, deserves real attention. Because yellow eyes are not your face trying a new color palette. They are blood chemistry, liver filtering, bile flow, and red blood cell cleanup showing up in the one place everyone can see. Right in the whites of your eyes. Unexplained bruising. Finding a bruise you do not remember earning feels suspicious. You look at your leg in the shower and think, did I fight a coffee table? Did the chair attack me? Did my body go out last night without me? A bruise happens when tiny blood vessels under the skin break and leak blood into the surrounding tissue. At first it may look red or purple, then it can shift green, yellow, or brown as the body breaks down and clears the trapped blood. Basically, your skin is showing the cleanup timeline like a tiny crime scene documentary. The everyday version is usually boring. You bumped your shin on the bed frame, carried heavy bags, leaned into a desk corner, or hit your arm on a door handle and forgot 3 seconds later, because adult life is just walking into furniture with responsibilities. But if bruises appear often, show up without clear injury, are unusually large, take a long time to fade, or come with nosebleeds, bleeding gums, heavy bleeding, fever, fatigue, or sudden changes, that is worth paying attention to. Easy bruising can be linked with fragile blood vessels, aging skin, low platelets, blood clotting problems, some medications like blood thinners, liver issues, or vitamin deficiencies. The point is not to panic every time your thigh has a mystery purple stamp. The point is to notice patterns. One random bruise may just mean your coffee table has been training in silence. Repeated unexplained bruising is more like your body leaving sticky notes in blue and purple ink. Because bruising is not just skin changing color. It is broken capillaries, leaked blood, clotting, cleanup chemistry, and sometimes your body quietly saying, maybe stop blaming the furniture and check the pattern. White tongue. Morning breath is already rude enough. But when you look in the mirror and your tongue looks like it got lightly dusted with chalk, your mouth has officially added a visual announcement. A white tongue often happens when the tiny bumps on the tongue, called papillae, trap bacteria, dead cells, food debris, or dried mucus. Think of your tongue like a carpet with millions of tiny fibers. If the cleaning crew falls behind, the carpet starts collecting evidence. Dry mouth, mouth breathing, dehydration, smoking, fever, poor oral hygiene, or not cleaning the tongue can all make that coating more obvious. The everyday version is waking up after sleeping with your mouth open like a confused goldfish, then wondering why your tongue looks like it spent the night in a dusty attic. Usually, drinking water, brushing, gently cleaning the tongue, and fixing dryness can help. But the pattern matters. If the white coating is thick, painful, keeps coming back, bleeds, comes with sores, bad burning, trouble swallowing, or patches that do not wipe away, it may be something else like oral thrush or irritation that deserves attention. This is where the internet becomes dangerous because one search can turn "my tongue looks weird" into "goodbye everyone" in 6 minutes. Do not do that to yourself. Notice the basics first. Is your mouth dry? Are you sick? Breathing through your mouth? Skipping tongue cleaning? Drinking enough water? Because a white tongue is not automatically a disaster. Sometimes it is just bacteria, dryness, and dead cells throwing a tiny blanket over your taste buds. But if the blanket starts acting suspicious, your mouth is not being decorative. It is leaving a note. White ring around eye. You only notice it in the worst mirror possible. Bathroom light too bright, phone camera too close, and suddenly there is a pale gray-white ring around the colored part of your eye. Like your eyeball quietly installed a tiny moon halo without asking permission. Maybe it shows up in a selfie. Maybe someone leans in and says, "Wait, has that always been there?" Very helpful. Extremely normal thing to say to a person. That ring is often called corneal arcus. It forms near the edge of the cornea, the clear front window of the eye, when tiny fat deposits collect in a circular pattern. Not dust, not eye mold, not your iris trying to become a planet. More like the body leaving a faint lipid watermark around the glass. The strange part is that it usually does not hurt. No burning, no dramatic movie scene, just a quiet ring sitting there like a polite warning label. In older adults, corneal arcus can be common and often harmless because the body changes how it handles fats over time. But when it appears in younger people, it can sometimes point toward high cholesterol or lipid problems. Think of cholesterol like oil in the body's delivery system. You need some of it, but if the balance gets messy, traces can show up in places you did not expect, like your eye drawing a tiny receipt at the edge of the cornea. So do not attack your mirror, panic search for 6 hours, or ask your phone camera to diagnose your entire bloodstream. Context matters. Your age, family history, cholesterol levels, and whether the ring is new. Because a white ring around the eye is not your eyeball getting fancy. It is cornea, fat deposits, age, and lipid biology quietly whispering, maybe check the oil in the engine before the dashboard gets louder. Spoon nails. Your nail should not look like it is trying to hold a raindrop. You notice it while washing your hands, scrolling your phone, or doing that weird inspection where you suddenly become a detective of your own fingers. The nail looks thin, soft, and dipped in the middle like someone installed a tiny useless soup bowl at the end of your hand. This is called koilonychia, or spoon nails, and it happens when the nail plate curves inward instead of growing with a normal, gentle arch. The sneaky part is that nails grow slowly, so they do not report today's problem today. They are more like your body mailing a delayed receipt from weeks or months ago. One common link is iron deficiency, because iron helps make hemoglobin, the oxygen-carrying protein in red blood cells. When iron runs low for long enough, fast-growing tissues like hair, skin, and nails can start acting weird. Think of the nail like a tiny construction site that keeps receiving cheap materials and confusing instructions. Eventually, the roof sags. But one weird nail does not automatically mean disaster. It could be trauma, repeated chemicals, genetics, circulation issues, or just that one finger having a bad career. The pattern matters. Are several nails changing? Are you also tired, pale, dizzy, short of breath, or craving ice like your freezer became a snack drawer? Those clues tell a bigger story. So do not stare at your fingernail and let the internet turn you into a medical detective with no badge and 12 tabs open. Notice it. Track it. Be gentle with your nails. And if the change is new, spreading, or comes with other symptoms, it deserves attention. Because spoon nails are not just a strange manicure, they are nail shape, oxygen supply, iron, growth cycles, and your fingertips quietly saying, the building materials might be running low down here. Angular cheilitis. The corner of your mouth should not feel like it signed a tiny breakup contract every time you smile. You laugh, eat something spicy, open your mouth too wide, and suddenly the corner cracks, like old paint on a haunted doorframe. Angular cheilitis happens when the skin at the corners of the mouth becomes inflamed, split, sore, or crusty. It often starts with moisture. Saliva collects in that little corner pocket, then dries, then irritates the skin. Repeat that enough times and the area becomes a tiny swamp with terrible management. Once the skin barrier is damaged, yeast or bacteria can move in like bad tenants who saw a broken window and immediately brought furniture. The annoying part is how everyday the triggers can be. Dry mouth, lip licking, braces, dentures, drooling during sleep, cold weather, irritation, or certain nutrient deficiencies can all make the corners easier to crack. You think you are helping by licking your lips, but saliva dries fast and leaves the skin even more irritated. It is basically trying to put out a fire with soup. Not ideal. The pattern matters too. A tiny crack after cold weather is one thing. Repeated painful cracks, bleeding, swelling, white patches, or sores that do not heal are worth paying attention to. So, do not keep stretching your mouth open like you are testing a damaged rubber band. Keep the area protected, avoid constant licking, and notice whether dryness, dental appliances, or irritation are part of the cycle. Because cracked mouth corners are not just dry lips being dramatic. They are moisture, friction, broken skin barrier, microbes, and your face placing a tiny warning sign exactly where every smile has to pass. Milia under eyes. That tiny white bump under your eye is not asking to be squeezed. It just looks confident because it knows you are standing in front of the bathroom mirror with dangerous ideas. Milia are small cysts that form when keratin, the tough protein found in skin, hair, and nails, gets trapped under the skin instead of shedding away normally. They often show up around the eyes because that skin is thin, delicate, and apparently loves hosting tiny pearl-looking squatters. The problem is, Milia can look like whiteheads, so your fingers start preparing for a mission they are absolutely not qualified to perform. But unlike a pimple, Milia usually do not have a soft plug of oil and pus waiting to come out. They are more like little keratin beads sealed under the surface, like your skin accidentally laminated a crumb and filed it in the wrong folder. The everyday trap is thinking just one squeeze. That is how one harmless bump becomes redness, irritation, a mark, or a full facial regret documentary. Heavy creams, skin damage, sun exposure, slow cell turnover, or irritation can make Milia more likely in some people, but often they are simply annoying and harmless. Gentle skincare matters more than bathroom surgery. Avoid picking, use sunscreen, be careful with thick products around the eyes, and if a bump stays, grows, hurts, changes, or bothers you cosmetically, it is safer to let a professional handle it. Your under-eye skin is not a cutting board. It is thin, sensitive tissue with trust issues. Because Milia are not acne being shy, they are trapped keratin, slow shedding, delicate skin, and one tiny white bump trying very hard to make your fingers do something stupid. Which sign surprised you most? Tell us in the comments, and stay tuned for the next video by liking and subscribing to the channel. Thank you for watching.